I'm Andrea Couoh, and as always on this broadcast, we're going to talk about the most relevant topic on our country. And for today's topic, it's about COVID-19 and health issue that it's not only affecting Merida, it also affects to everyone around the world. And as always, we bring to this program an expert, and with us we have the Dr. Lizbeth. It's a pleasure to have you with us today. And let's begin with the first question. First of all, what is COVID-19? Thank you for inviting me. As the World Health Organization said, the COVID-19 is caused by the virus SARS-CoV-2 and it produces on the body the respiratory disease. The level of difficulty depends on every patient, but it's important to clarify that it isn't a life-threatening disease if it's detected on time. A very helpful information. Secondly, how people can get infected. The way of propagation is very common, that's why it's very fast the propagation of the virus. It could be with any contact with the saliva or a surface contaminated. The contact with the person, it could be by a cough or a sneeze, and shaking hands with someone that is infected, with also touching or have contact with a superfice contaminated with the virus. As you say that it could be so easy to get infected, what are the symptoms of COVID-19? According to the CDO, the symptoms are cough, shortness of breath or difficulty to breathing, fever or chills, muscle or body itches, vomiting or diarrhea, new loss of taste or smell. Oh, an interesting and lifeguard information that you are sharing with us. And who are more likely to get infected? In general, everyone can get infected, but the population that are in highly risk are senior citizens, people with diabetes, people with hypertension, people with obesity, people on pregnancy, people with cancer, people with hair problems, people with HIV, people with renal disease, people with asthma or COPD, people with a recent transplant, people with suppressed immune system, and people with a liver failure. Now let's move to talk about a more positive and a call to action aspect. Does the COVID-19 have any solution or any strategy to be on a low risk of getting infected? Yes, you can decrease the risk of being infected by being fully vaccinated with any option that your health service provides you. It could be CanSino, AstraZeneca, Johnson & Johnson. Any option is very good and safe, but it's important to mention that you should not mix any dose. Also, by following the new health protocols that our governments are establishing, as in our case it's in Yucatan, and it says that you should wash your hands frequently with soap and water, stay away of people around 1.5 meters, don't go to parties or reunions, and stay at home most of the time. Don't avoid touch your mouth, nose, and in general your face when you are outside. If you want to sneeze, sneeze on your arm. Now let's see some statistics of Merida about COVID-19. Merida has 48,863 cases of COVID confirmed. That represents the 63.71% of cases from Yucatan. Unfortunately, also Merida have 3,503 cases of death. That represents the 55.02% of cases from Yucatan until 15th of November. The percentage of contagion is of 5.47% and the percentage of death is 0.39%. Thank you for being here, Dr. Lizbeth, and that's all for today's broadcast. I hope you be more educated and informated about COVID-19. I hope to see you on the next broadcast. Bye.